Hello, I'm Dr. Nicholas Cohen, and I'm here to share with you a top 10 list of tips for heartburn in pregnancy. These are 10 tips to prevent, identify, and treat heartburn for pregnant women. Tip number 1 is to know when you have heartburn. This is a burning sensation, or sometimes you have reflux, which means that stomach acids come up into your throat and mouth after you eat. It's extremely common in pregnancy. At least half, and some sources say 80% of women in pregnancy develop heartburn. It usually gets worse throughout the pregnancy. And the causes are you have abdominal pressure from the baby, and also the lower esophageal sphincter, which is the ring that closes your stomach off at the bottom of your throat, tends to relax during pregnancy. So you have two reasons to have reflux and heartburn in pregnancy. And lastly, if you think you have these symptoms, it's okay to treat on your own. But if anything severe, like pain or vomiting or difficulty swallowing or pain when you swallow or blood in your stool, any symptom that's not just a little bit of burning or reflux of fluids after meals, for any of those above symptoms, you should definitely see your doctor, just to make sure that it really is just heartburn. Tip number 2 is don't smoke or drink alcohol. There are many reasons not to smoke and drink alcohol in pregnancy. And I would say improving heartburn is at the bottom of the list, but it's still an important thing to remember. Smoking and alcohol both make reflux worse. So avoid all tobacco use and all alcohol during pregnancy. Tip number 3 is make sure you gain a healthy amount of weight during pregnancy. What's a healthy amount of weight? Well, first of all, you should know your body mass index, or BMI, before you were pregnant. So what was your weight before you were pregnant? And if you go online or ask your doctor, you can look for a BMI calculator and calculate your body mass index before you were pregnant, which you'll need your height and your weight to calculate. If your body mass index, or your BMI, before you became pregnant was less than 30, then you should gain 25 pounds during your pregnancy. If your body mass index was between 30 and 35, then you should gain only 20 pounds during your pregnancy. And if your body mass index was more than 35, then you shouldn't gain weight at all during your pregnancy. Again, the reason for this is because the extra weight causes increased pressure on your stomach, and that can make your reflux worse. There are other reasons, though, to not gain too much weight during pregnancy that are probably more important than avoiding heartburn. But it is important to realize that maintaining a healthy weight gain is an important way to help with your heartburn. Tip number 4 is to elevate the head of your bed. In this picture here, we have cinder blocks under the legs of the bed that are at the person's head. You want to elevate your head, elevate the head of your bed about 6 to 8 inches. Also, you want to avoid meals 3 hours before bedtime or sooner, because the food will still be in your stomach when you lie down, and it can easily go back up into your throat, causing your reflux. And it's also important not to lie down after meals. This will give gravity the chance to move the food out of your stomach so that you don't have reflux. Tip number 5. There are certain foods to avoid if your reflux is worse. If your reflux is worse after eating these foods. These foods include cola, orange juice, fried foods, chocolate, and peppermint. I understand these are a lot of people's favorite foods, and it's important to realize that this is just a list of foods that generally cause heartburn. but if they don't cause a problem for you, then you don't need to avoid them. You should avoid foods, though, that make your heartburn worse, and these are some of the common, the usual suspects when it comes to making your reflux worse. It's also important when eating to eat small, frequent meals. You should eat while you're pregnant, you should eat and especially if you have heartburn, about 5 to 6 meals a day. That's about every 3 hours. Drink plenty of fluids as well. Tip number 6 is sugarless gum. Sugarless gum after meal is a good idea. Any of these brands would work. And what it will do is it will help you produce saliva. Saliva will help wash the food down past your stomach and into your intestines and out of your throat so that you won't have reflux as bad. Tip number 7. So we've talked about all of the non-medication ways of treating heartburn. Before you start medications, like even over-the-counter medications, it's really important to talk to your doctor to make sure that this is really just heartburn and to have your doctor and you decide on the best treatment at this point. What I recommend are antacids, and any of these over-the-counter antacids will do if all of the measures I've discussed so far don't solve your heartburn problem. These are medications that you can take as soon as you feel heartburn symptoms after you eat. So if you've tried these over-the-counter antacids and you've tried all of the tips that we've discussed so far, the next medication that I recommend is Renetta, which is a H2 blocker, and the brand name is Zantac. You can get this over-the-counter, and it is safe in pregnancy. The dose I recommend is 150 milligrams. It's one tablet, and you take this one tablet twice a day, the first one being before breakfast. I recommend that you start off just taking this as needed, but if your heartburn remains just taking it as needed, then I recommend you take it on a scheduled basis, twice a day, every day. Tip number 9. If you've tried all of those lifestyle changes, you've tried the antacids, and you've tried the Renetta, and you're still having heartburn, I recommend lansoprazole or Prevacid. It's a 15 milligram tablet. I recommend taking it 1 hour before breakfast. This is a proton pump inhibitor. The reason I chose this one, and there are several different ones, is that it's pregnancy class B, which means that it hasn't been shown to cause any harm in humans. Some of the other proton pump inhibitors, like omeprazole, are pregnancy class C. Otherwise, I would have recommended them. There are a few pregnancy class B proton pump inhibitors. The reason I chose lansoprazole is because it was the least expensive I could find, and it is available in a generic form. This is a pill you'll take once a day before breakfast. And tip number 10 is to believe in yourself. I've discussed several ways of modifying your lifestyle and a couple of different medications, all of which can help with your heartburn in pregnancy. Pregnancy is a great time, and there's no reason to have heartburn interfere with the excitement of having a baby. I hope these tips have been helpful. Thank you very much for listening, and have a great day.